All right. Well, thank you all for joining us today. Good afternoon, and welcome to the first of our new Alumni Insight webinars featuring Jonathan Ogurchak, pharmacy graduate and Vice President of the Duquesne Alumni Board of Governors. I'm Sarah Speary, the AVP of Alumni Engagement and your moderator for the program today. I'm so pleased to have you join us to learn more about the growing industry of specialty pharmacy. I'd like to take a moment to thank my colleague and alumna Audrey Tierney, Associate Director of Alumni Engagement, for arranging for this program. Audrey will be managing the tech end of this program, including the chat button. Throughout the presentation, your microphones will be muted, but you're welcome to submit questions throughout the chat feature found in the toolbar at the bottom of the screen. I'll ask the questions of Jonathan following the full presentation. Now a few words about our presenter. Jonathan is the founder and CEO of Stack, a compliance management software designed to simplify the outside of the dispense complexities associated with running successful pharmacy organizations. He is also managing partner of Rhythm Group, consulting and technology solutions organization, and is a certified consultant with Accreditation Commission for Healthcare. Jonathan has taught lectures on specialty pharmacy in both the classroom at Duquesne, Pitt, Rutgers, and more, and speaks regularly at national conferences on specialty and technology. He's also the president-elect of the Pharmacy Alumni Association, and you can see him regularly behind the bench at Duquesne's men's basketball games sporting his red sweater vest, which he's not wearing in his office today, I might add. I've worked with Jonathan over the past several years through the Alumni Board, and you will find no alumnus more dedicated to Duquesne than Jonathan. I look forward to working with him over the next 2 years as he takes over as the president of the Alumni Board in the summer. Jonathan, I'll turn the program over to you.
Good afternoon, everyone. Sarah, thanks so much for that great introduction. And for those of you who are joining today virtually, I'm really excited for the opportunity to kick off this Duquesne Alumni Insights series for us. So I was asked to talk a little bit about specialty pharmacy and the industry as it relates to how it can affect not just those of us that are joining today as part of the pharmacy alumni group, but from the university as a whole, because with this being such a growing sector of healthcare as a whole, there's a number of opportunities for any one of our schools of pharmacy, or schools across the university, to really grow and expand our reach to be involved from a career perspective. Audrey gave a little bit of a background about myself, but here I am, here in the flesh. I have my red sweater vest here. If would be interested in me throwing it on for the question and answer portion. But as Audrey mentioned, Duquesne, I love Duquesne, to a fault, to a certain degree. I was there for my PharmD program. I did a teaching and research fellowship. I continue to give back as we go through the alumni associations, both at the university and the pharmacy school level. But as far as my experience, my expertise, there's that sweater vest that we mentioned. I've been involved in the specialty pharmacy sector for most of my career. I teach specialty pharmacy insights at the University of Pittsburgh. I write and I'm a part of the editorial board for the Specialty Pharmacy Times. I consult for the National Association of Specialty Pharmacy. There's a lot that's going on in this segment of the industry. And I always find that it's important to bring that to light, because unless you know of somebody who was diagnosed with a specialty disease condition, or somebody like myself that's worked in the specialty pharmacy industry, you probably don't know what specialty is. And if you don't have an awareness of what that might be, then there's chances are you don't know that there's career opportunities for you to grow and expand your scope and your reach as a professional. So we're going to talk a little bit about the history of specialty pharmacy first, just to kind of put it into a framework so you can understand what the intent was, where it really came from, and what role it plays across the continuum of healthcare in the United States. Really, specialty pharmacy was built. It was capitalizing on an opportunity that was in the marketplace, and it started right here in Pittsburgh. So in the late 80s, that was right around the time that UPMC, or what's now known as UPMC, was starting to build a solid organ transplant program out of Montefiore Hospital, right up the road from campus on the bluff. And At the time, this was really the first in class, the first of its kind nationwide, where patients can now fly into Pittsburgh. They can get a new liver, a new kidney, a new heart, and get a new lease on life because they are now able to function more appropriately and go back to their home and start living their lives again. The problem with that, though, is, and those of you that are familiar with anyone that's ever received an organ transplant, your body needs to start taking medications to suppress your immune system's response. So that way your body doesn't start to attack that new kidney or new liver and think that it's a foreign thing and try to get rid of it. And so this new class of medications called immunosuppressants came to the market, and they were developed here at Pitt as well. And patients were coming to Pitt, they were getting a new organ, they were going back home, and their local pharmacies didn't have the expertise or the understanding of how to dispense those medications. And so a pharmacy that was based in Monroeville actually started this concept of centralizing the fill of these medications, but mailing them across the country. They became the specialists, the experts in how to manage transplant care. And they did that all remotely. So that patient could fly in, get their new heart, they could go back to Florida so they can enjoy the sun and enjoy this new lease on life that they had, and the medications would just be shipped right to their door. Those pharmacists and the staff that were managing those patients really knew the ins and outs of what was needed to manage the maintenance of that new organ and work with the physicians to make sure that patients weren't losing these organs, they weren't rejected, and then they had to get back on a wait list for a new organ. So it really built a new model of this hands-on clinical pharmacy approach that you didn't necessarily see in the community pharmacy setting. Now, once that model was established and it was built to manage patients nationwide, they started to expand their capabilities at this pharmacy to manage other things like supply chain shortages. In the early 90s, that's right when the HIV epidemic was in full swing, and manufacturers of medications were coming up with new novel types of treatments to help treat HIV. And the problem with that is, though, the number of patients that were needed to manage was so great that those manufacturers could not keep up with the demand to bring those drugs to the market. The way that HIV works as a virus, if you start to treat it with one type of drug and one way to treat it, if you have a drug holiday, if you stop taking that drug for any point in time, that virus can mutate and the drug may no longer be effective. And so this pharmacy in Monroeville started to work with manufacturers of these new HIV drugs, and they would only start patients on those drugs when they knew that the supply from a manufacturing perspective could meet with that demand. So that way you weren't going to run into any issues with running out of drug and the virus mutating. You weren't going to run into any issues where patients were becoming non-compliant because they weren't managing the side effects. It was really a very hand-in-glove type of approach to managing patient care as it related to the treatment of HIV with these new medications. And once that model was built here in Pittsburgh, it really stuck because insurance companies found that there was a way to manage costs associated with these products. There are ways to improve the utilization of these drugs for patients because they could become more adherent. They could find new ways and novel ways to engage with those patients, to have more frequent interaction with them, to ensure that these patients were being managed to the fullest. Oftentimes what you tend to see with specialty drugs is that you don't necessarily see them in a community type of setting. So that lends itself to the question, so what's so special about specialty pharmacy? Because clearly it's still a licensed pharmacy, just like your corner drugstore that you may see in your hometown, that holds a license with the State Board of Pharmacy, and so do specialty pharmacies. Where the difference starts to come into play is there's generally a requirement for a third-party accreditation, similar to a hospital pharmacy where they need to have a seal of approval from an external third party to make sure that they're managing patients appropriately in an inpatient setting. Specialty pharmacies need to have those seals of approval to manage their overall scope and their continuity of care to ensure that these patients that require a higher touch are getting that higher touch. Oftentimes these medications you're treating much smaller patient populations. And I have a graphic here in a moment to kind of illustrate that. It's not the general run-of-the-mill. You're not going to see a ton of antibiotics being dispensed unless it's helping to treat another corresponding disease state. These drugs are really focused on very small, very niche, very novel sorts of populations. Also, there's a higher level of touch for everybody that's going to be involved in the specialty prescribing process. Patients are having proactive outreach. The specialty pharmacy is coordinating with each patient on at least a monthly basis. How are you feeling? Are you having any troubles with your medication? Are you noticing any side effects? Are you having any troubles with other components of managing your disease outside of just the drug? You know, are you having issues with weight loss or nutrition, or really just the overall quality of care? The specialty pharmacy becomes the more frequent touch point than even the doctor in a lot of cases once these patients are established. That higher level of touch also moves on to the prescribers of these medications as well. A lot of times with these being such niche, small patient populations, the doctors may not know what's needed to get the drug approved through an insurance company. They may need assistance with a prior authorization. A lot of times I even had conversations with doctors. They didn't even know which drugs to write, which ones would be most appropriate based on the way that the patient's presenting and their diagnosis. And so oftentimes the pharmacists are speaking with the doctors to basically counsel them and say, these are the drugs that are most appropriate, not only based on how this patient's presenting clinically, but also based on this patient's insurance and what may be covered. There's a higher touch for insurance companies as well, and those payers to have a specialty pharmacy engaged. So if you look at every patient of an insurance company as a small investment, you want to make sure that you're getting the most out of that. These medications for specialty conditions are intended to be curative. They're intended to be something that's preventing additional hospitalizations. They're really something that every time an insurance company is paying for that drug, they're investing in you as a patient. And so if a specialty pharmacy can become engaged as the drug expert, as the disease expert, and they can help to mitigate any concerns of using that drug, insurance companies can benefit from that because you're making sure that you're getting the most bang for your buck with the investment of those patients. Lastly, there's a high level of touch when it comes to working with the manufacturers of these medications as well. Within the patient populations being so small, oftentimes it makes it difficult to learn enough about them during clinical trials. Specialty pharmacies can serve as an extension of a clinical trial to provide additional data and information about how the drugs are working in patient populations. They can also ensure that there is that higher level of touch. Patients are being managed appropriately on a month-to-month basis. And so that way, that higher level of touch and proactive engagement really builds a patient journey, if you will, from the time that they're receiving their life-changing diagnosis all the way through these preventive and potentially curative steps to maintain them on an ongoing basis. That's really what specialty tends to be from this overall management perspective. But really, that definition varies from manufacturer to manufacturer. You know, if you ask me if I was the manufacturer of a drug, is your drug special? Of course it is. You know, I've spent a lot of time in research and development coming up with this potential solution that I'm bringing to the market. And so every manufacturer can come up with their own definition of what might be handled by a specialty pharmacy or not. Similarly, every insurance company can come up with their own definition of what is a specialty drug. There are some that may look at it just as a cost containment measure due to the price of an individual medication. There are some that might look at it across an entire disease class. And maybe geographically for an insurance company, there's a lot of patients that have one disease. And while it might not be a huge cost on a patient-by-patient level, if you have many more patients with that disease, it becomes a cost prohibitive sort of thing to manage. So insurance companies can even define what is a specialty drug for me versus not. But in general, there's some definitions that tend to come into play, and usually one or more of these categories helps to define what a specialty drug might be. Historically, it's been used to treat things like chronic conditions, disease states like organ transplant and HIV, rheumatoid arthritis. Anymore, though, there's been advancements in certain drug development where there might be curative types of therapies, things like hepatitis, where you used to be on chronic medications. Over the last several years, you've been able to see curative therapies come to the market that are being managed through specialty pharmacies. Oftentimes, these drugs are initiated by a specialist. You're not going to see a primary care physician or somebody in a minute clinic that's writing for a specialty drug. Chances are you started at that path as a patient, but then you've been referred out to a specialist, someone like an oncologist, a rheumatologist, a gastroenterologist. That specialist is the one that becomes the diagnostician. They understand the nuance of how to diagnose patients with these more rare conditions. And they're the ones that then write for the prescription. Sometimes there's some special handling that's involved. Maybe there's some temperature sensitivity. So you need to make sure that the drug makes it from the point of manufacturer to the patient and it doesn't expire. It doesn't go bad in that transit. Maybe there are some certain considerations, special handling wise, if it is a higher cost product, they want to make sure that that drug shows up to the patient and there's an awareness that it's there, and you don't have these high cost products get taken off of a porch, somebody's walking through the neighborhood and doing those things. You want to make sure there's an awareness from a handling perspective that these drugs are available. I teach these sorts of lectures at the university level, and I ask, well, what do you know about specialty pharmacy? Usually the first question that comes up when they raise their hand is, well, it's expensive. And that tends to be the case, but that's not necessarily a requirement for a drug to be considered a specialty drug. The Center for Medicare and Medicaid Services, their kind of loose definition right now says that if the drug costs more than $670 per month per patient, it can qualify as what CMS views as a specialty product. If you look at annualizing that, that's about $8 grand a year. That might, from a drug cost perspective, that's a lot of money. There are some drugs that well exceed that cost. You're looking at $50,000, $100,000, $1 million per patient per year. And so cost containment does come into play when you're looking at managing specialty therapies. There's a concept of restricted distribution. The drug may be restricted, so not every pharmacy can purchase it, and we'll talk about that a little more in just a minute. It might be something where it's manufactured by a biotechnology manufacturer as opposed to just a solid, like a pill or a tablet, like you would for most drugs that you get in the community setting. It may be injectable, and so it requires additional training for the patient or the caregiver to understand how to administer that drug. And the drug might have an additional side effect profile that the FDA warrants having some additional programs or services in place through their Risk Evaluation and Mitigation Strategies program, or REMS, that ensures that additional information is captured for these patients before it's dispensed to them. Is there a risk of pregnancy defects? Are there risks of liver function considerations? Are there risks of addiction? Those sorts of programs can be mandated by the FDA as a drug is brought to the market, just to make sure that the drugs are being utilized and the benefit outweighs the risk of starting on. This is that graphic that I mentioned to kind of illustrate what we're looking at from a patient population perspective. So patients, let's use high cholesterol as an example. You can get drugs for hyperlipidemia in any community retail pharmacy that you see nationwide. And part of the reason for that is the number of patients. And this is to scale. I took the time to make this to scale so you can have an understanding of what this looks like. You're looking at about 102 million patients in the US that are taking some type of drug to treat high cholesterol. Even fewer than that of patients in orange that might have a drug that they're using for autoinflammatory disease, or something like rheumatoid arthritis. So drugs for RA, you might be able to receive them in a community setting. You might be able to have them mandated through a specialty pharmacy. The thought being that there's far fewer patients that are being treated for RA than there are high cholesterol. Let's find a way to manage those patients more effectively. Even further still, you'll see that little green speck here in the middle of the screen. For ultra rare conditions, those like spinal muscular atrophy, there might only be 10,000 patients in the United States that are diagnosed with a condition like that. If you were to take those 10,000 patients and put that drug into a general population, it makes it much more difficult for a community pharmacist to understand what are the nuances, what are the ins and outs of managing patients with SMA. So if we restrict the ability to work with patients and you're only going to certain pharmacies that have that expertise, those patients are able to have a better experience overall. Here's just an example of some sample specialty conditions, things like cancer, oncology, RA, HIV, like we mentioned, hepatitis C, multiple sclerosis. Those types of conditions are your traditional specialty therapies. And again, you might see some of them dispensed in the community setting. Oftentimes, though, they are dispensed solely out of what's deemed a specialty pharmacy. There are other conditions that are a little bit more novel in nature, drugs like pulmonary hypertension, immune deficiency, hemophilia, concept of rare or orphan disease. There are far fewer patients with those conditions, even more so than things like rheumatoid arthritis. So those conditions on the right tend to always go through a specialty pharmacy dispensing model. And this concept of orphan disease came about in the late 80s. They wanted, at the time, there wasn't really an onus for drug development for these super small patient populations. And so the FDA put some considerations into play to say, we want to incentivize manufacturers to find solutions for these patients that may not have drugs otherwise. And so they put things like expedited FDA approval in place so that we didn't have to recruit as many patients for a clinical trial, because those patients might not exist. You see here, to be designated as an orphan disease, there need to be less than 200,000 patients in the population that have that diagnosis. There are certain conditions like SMA that I mentioned, they're ultra orphan diseases. There's so few patients that may have that diagnosis that to go and recruit them for a clinical trial, it's going to take way too long. And the benefit of bringing that drug to market would outweigh the ability to try to find more patients to go through a trial. So this Orphan Disease Act really helped to expedite that and get, incentivize manufacturers to develop these new treatments. There's other things like tax benefits, extended marketing exclusivity. Those sorts of things were really designed to help incentivize manufacturers from not building a new blockbuster drug that's going to treat 100 million patients, but focus on those patients that don't have solutions otherwise. Now, specialty pharmacy as an industry continues to grow, and I know it's a little bit small on the screen here, but just to kind of highlight, you'll see that dark blue bar across the bottom is where you're seeing more and more growth in the specialty spend. And this is something that I had borrowed from a conference that I attended last year, but it really helps to highlight where the growth is coming from. Specialty growth continues to be at the top. There's more and more drugs. It's outpacing the drug spend in the traditional community sector because there are more solutions now that are focused in these novel conditions than there ever were before. In fact, the FDA pipeline right now, about 70% of the drugs that are in development could be considered specialty drugs whenever they are coming to commercialization. Some data from last spring that highlights 2018's drug approvals, most of those drugs that are being approved, about half of them had an orphan drug designation. About 60% of them were first in class. They've treated a disease that's never had a mechanism in place to be treated before. And so more and more drug development is focusing on these types of therapies and bringing them to the market. Because that's where the new drugs are coming from, that's where you're starting to see this growth in the industry and why there's more specialty pharmacies that are out there. Now, we talked a little about these restricted networks, and I wanted to just touch on that for a minute to kind of highlight for those of you not aware with specialty, why there is a little bit of a difference. So if you are a pharmacy, you're licensed by a board of pharmacy, you have a pharmacist on staff, you can apply for a license to go out and buy medications. So that way your antibiotics, your blood pressure medications, those for diabetes, you have the ability to buy those drugs and dispense them to a patient whenever you receive a prescription from a doctor. Doesn't make sense for some of these specialty conditions to make those drugs widely available to every pharmacy nationwide because there are so few patients that are required. So from a supply chain perspective, from a patient management perspective, there's some benefit for manufacturers to limit that distribution. They don't want those drugs to be available to the tens of thousands of pharmacies nationwide. They may restrict the distribution to be to less than 1,000 pharmacies, to less than 100, to 2 pharmacies. They may limit the ability for those drugs to be purchased. And in turn, it allows those pharmacies to become those drug experts, to become those disease experts, and understanding what's needed to manage those patients appropriately. Some manufacturers may even go so far to have an exclusive provider. So there may be one pharmacy across the entire country, and that's the only place that you can go to gain access to those drugs because the patient experience, manufacturers really take into consideration what that patient experience looks like. And they want to ensure that there is some continuity of care and you're getting the highest level of service to manage both the disease and the drug. And so if services are provided, if there's a higher need for handling or touch, maybe it makes sense for there to be only one pharmacy where you can get that product. And oftentimes that is really restricted on the number of patients that are in that addressable population. So I throw this up here not to say this is a fully inclusive list, but to kind of highlight that there are different market segments and where you see specialty pharmacy taking place. You have some of those that are independently owned. They're not affiliated with a company like a pharmacy benefits manager or an insurance payer. They are independent owned, standalone organizations that focus in some of these specialty conditions. You're seeing some growth in the grocery and retail owned sector. So there's already a presence in the community where patients are being treated for their ongoing chronic conditions. Augmenting that care with a specialty pharmacy really helps to bring that whole patient management perspective together. You're seeing more growth in the hospital segment as well through things like integrated delivery networks. If you have to go to one of these specialist locations or centers of excellence to receive a diagnosis, let's then manage that patient's care through a pharmacy that's affiliated as well. So specialty isn't one and done. There's not a clear-cut definition of what it truly is. It really does transcend everywhere within the pharmacy industry as a whole. And that brings up the question, so what about retail? The community pharmacy setting, what's traditionally viewed as retail, there are some differences between what you see in specialty versus not. There's almost 80,000 community pharmacies nationwide and only about 800 specialty pharmacies. So there's a difference in how the size and scope, that restriction of availability comes into play when you're looking at specialty pharmacy. On the community side of things, it's traditionally driven by the patient. The onus is on the patient to refill their medication every single month. And so if you don't refill your cholesterol medicine, you're not going to necessarily receive much more than a text message or an automated phone call. On the specialty side of things, the business model is designed to have proactive monthly outreach. If you don't have communication with your specialty pharmacy after a few phone call attempts or email or text attempts, the physician's getting a call. Hey, have you been in touch with this patient? Do you know what's going on? We're having a hard time getting a hold of them. It's really more of a collaborative care effort to make sure that these patients are being spoken to every single month so there aren't lapses in care. On the community side, those practitioners tend to be generalists in nature. They make sure that they can treat any patient that walks through their door, and they may not have as much expertise in some of these smaller conditions that are those one-offs. When Mrs. Smith walks through the door, if she's the only patient in your hometown that has that disease, it makes it a little bit more difficult to be on top of the cutting-edge treatments for that. So the specialty pharmacist clinicians are trained in the complexity of those diseases and the drugs. And so the workflow truly matches the complexity of what comes into play with those therapies. So we're here today to talk about specialty as an industry and what types of opportunities are out there. And so with this being such a growing segment of the industry, with, like I said, 70% of those drugs coming into the sector, what are some opportunities for you as a professional to know where you can go from a career perspective? So it's not just for pharmacists, and that's what I want to highlight here. We'll get to the pharmacy piece in a minute because I mean that's pretty obvious. But there's aspects across every specialty pharmacy as a business where there are opportunities for you to look for growth and career opportunities. You're looking at it from a business sector. There's a need for finance, accounting individuals. With some of these drugs that are potentially a little bit more costly in nature, there's a need for a better revenue cycle management to come into play. And so one component of the continuity of care for these areas is to help those patients to manage those expenditures. Just because they were diagnosed with cancer, let's say, doesn't necessarily mean that they should go into bankruptcy because they may not be able to afford a treatment. And so there are services and solutions, whether it's applying for grant money, applying for copay cards and copay assistance, where the business aspect of the patient management comes into play. From an information systems management perspective, or even a computer science, data science perspective, with so few patients being in these populations, there's always the need to understand more about this patient. There were drugs that I've helped to commercialize where worldwide, there may have only been about 70 patients in a clinical trial. And that total addressable market is way bigger than that. So those 70 patients, you don't necessarily get as much as you would in a true clinical trial where you're looking at tens of thousands of patients. So the more data that you can capture, analyze, and then act upon is critical for these therapies. And so most specialty pharmacies have their own divisions that focus on software development, that focus on disease development, and focus on the data component to understand what's going on, not only internally to better manage those patients, but to stratify that across every pharmacy that's managing patients with that particular diagnosis. The legal side of things, there's a lot, I've talked to a number of law firms where they focus on healthcare law, and they help to understand the nuance of commercializing these therapies and bringing them to market. And so I've seen pharmacies that build their own internal legal counsel. They work with legal counsel that's out there for the drug manufacturers and the payers themselves. So there's definitely a need for legal professionals in this space as well. Nursing is huge. A lot of these therapies, they may be infused in the home. There might be a need for the pharmacy to ship that drug to a patient's home, and then a nurse arrives to actually administer that medication to the patient. And so home health nursing and home infusion nursing is a critical component that correlates with specialty pharmacy. And there are opportunities for nurses to get involved there as well. On top of that, from a marketing, from a public relations, drug manufacturers are always looking for new novel ways to get direct to patient to understand some of these conditions. 5 years ago, it wasn't as prevalent where you would see these specialty conditions that were being advertised. But you turn on Wheel of Fortune now and you're seeing drugs for hepatitis C that are being advertised. There's a definite need for awareness for these types of medications, because if patients don't understand the side effects, or they don't understand the symptoms that they're experiencing, they may not know that something's wrong, and they may be less inclined to go see a physician. And so awareness and understanding of what these drugs can do, or what these disease processes can do, you're seeing more of that type of advertising in the marketplace that's direct to consumer. Physician assistants are critical in that diagnostic process, and working hand in hand with the specialty pharmacies and those specialist providers. If you look across the scope and the scale of what Duquesne offers, and that's kind of where I tailored this type of presentation for career opportunities, you're looking right here at 5 of the schools outside of pharmacy that Duquesne helps to support. And there's definitely areas where there's a capability to go and work for a specialty pharmacy, just helping to keep their business operations up running and ongoing. That comes to the role of what the pharmacist does then. We talked about them being that disease expert. We talked about them being that funding expert to help the patients to better align and understand what's needed to afford these sorts of therapies. And on top of that as well, there's also the distribution piece of things. It's one thing to actually go through the clinical management of a product, but you need to have the ability to get that drug across the final mile. Is it the right drug? Is it the right patient? With most of the correspondence of specialty pharmacy not being apparent, it's more behind the scenes, it's over the phone, it's over a telemedicine type of provision of care, then there's a need to be able to provide that drug and fulfill that drug direct to the patient. And so opportunities for pharmacists are huge. And that's, when you think of pharmacy as a career opportunity, that's probably what you're looking at. You can be a clinical pharmacist at a specialty pharmacy. You become that disease expert. You're the one on the phone with the patient to counsel them about side effects, to counsel them about their disease. You're on the phone with physicians to get them to better understand what's going on within the diagnostic or the drug selection process as well. You can go work for industry, if you will, in the pharmaceutical manufacturing space and help to commercialize these drugs, to bring them to therapy. Pharmacists know how to get the drug to patient. Manufacturers really know how to develop those drugs, and they may have a little bit of a gap with the actual delivery from manufacturing to the patient itself. And so it gives you the ability to work within the scope of the industry to commercialize these drugs and bring them to market. On the payer side of the world, you can work in formulary management. You can work on the benefit design and understanding to know how these drugs are going to come into play and actually help to be delivered and benefit to those particular patients. And so you see pharmacists all the time working at a health plan to help to determine which drug are we going to cover. What are the clinical criteria to ensure that this patient has a diagnosis that warrants starting this therapy? And so there's a huge piece from the formulary management perspective as well. Pharmacists are even getting more involved in the data and outcomes piece. I mentioned the computer science piece where you're doing the blocking and tackling to actually extract that information. There's the need to then interpret that information. What do we need to do to change our course of care? What do we need to do to make some recommendations either back to the manufacturer, back to the FDA, even internally for how we better manage these patients? If there's an understanding of how to manage that from the data, you need to make sure that those things come into play and they're being addressed. So I went a little bit quicker than I may have intended here, but the point of it is I wanted to leave the opportunity open for some questions and answers as it related to this concept. Like I said at the outset, specialty pharmacy, being a pharmacist myself, it's one of those types of professions that when you're sitting around the dinner table at Thanksgiving and grandpa asks you about how to titrate his Coumadin dosing, not something that you're as intimately familiar with because you become that expert. And so because there's not as much awareness or understanding of what this industry can entail, we want to make sure that we can address some of those questions and show where there might be opportunities for you as professionals and as alums of Duquesne to know where you might be able to look for some of these opportunities. So Sarah, I'm going to flip it back over to you. I left more than enough time. I saw we had a bunch of questions coming in through the chat. So I want to make sure that we address those and some of the ones that were pre-submitted as well.
Absolutely. Thanks, Jonathan. The first question in the pre-submission was, what computer languages are most useful for writing pharmacy software?
It's a great question. On the software side of things, most of the framework that is out there with either existing softwares or ones that are being developed, you're seeing two schools of thought. You're seeing a lot of pharmacies that want to keep their data in-house, and so you're being expected to build on-premise solutions. Most of those systems are Windows-based, so if you have C# experience, if you have .NET experience, that tends to be like the back end of where these systems are built. With the advent of cloud computing, however, you're seeing some of the systems translate and move over into more of a virtual delivery of care. And so if you have the expertise to actually build some of those frameworks in an online setting, that is going leaps and bounds further than it ever used to before. So if you have experience with JSON and those sorts of languages, you tend Linux, it tends to be another avenue where it can cross and transcend what that capability set is. Specialty pharmacy as an industry, though, tends to be a little bit behind the curve as you're looking at technology. And that's where you're seeing the advent of new softwares come to the market that give you the ability to try to give patients what that experience is. So many people are used to logging into Amazon, especially nowadays. Log into Amazon, I don't want to go into the store, and I can find something in real time that shows up on my porch a couple days later. The consumerism of how most other industries have been related is what patients are coming to expect from their pharmacy experience as well. And so you're seeing this advent of innovation as it relates to new technology, just to ensure that patients can see that similar sort of awareness and understanding. You're seeing things that are being developed on the Apple Watch or on your iPhone to help to put the tools that patients already have at their disposal right into their fingertips and use it to manage their care, because the maintenance of their disease and their diagnosis for these specialty conditions is something that they live with on a day-to-day basis. So more focused on the Windows side of things, more focused on less on the Mac, except for like the iOS piece. On-premise versus cloud. There's a number of different avenues that, from a computer science and on a language perspective, we focus on now. The computer science program that we support here and the data science program here at Duquesne. I'm not intimately familiar with it, but based on the description I could research, all of the languages that you can learn as part of the curriculum here focus right in line with what is expected from the pharmacy development perspective. So I hope that answers your question. If not, feel free to ask some additional follow-up in the chat there.
Sure. The next question was asking about where specialty pharmacies are located, and I guess a follow-up was, are work from home options available? And that is a timely question, I guess.
Yeah, it's a very, very timely question. So specialty pharmacies are really located all over the country. You tend to see areas like Pittsburgh that are more densely populated with specialty pharmacies. You figure 30 years ago, the first specialty pharmacy was built here in Pittsburgh. And actually, those of you that are familiar with the area, the old Exmo Mart in Monroeville is now home to CVS's specialty pharmacy headquarters. They converted it from a convention center into this fully automated system. And that's actually what that old pharmacy was through the series of merger and acquisition. So those types of pharmacies are really based, they tend to be in clusters, what you'll see, but there are some one-offs just based on requirements from either state boards of pharmacies or insurance companies. And so with there being upwards of 800 pharmacies nationwide, they are located geographically all over the country. Some of them will have national scope. If you are an exclusive pharmacy where you're the only pharmacy in the country that has access to the drug, you need to be able to ship it all over the country. And so you may be located in one area, but you may have little pockets or little clusters of remote pharmacies that help to dispense those products. You might see some that are more regionally based, where they can really focus on knowing what the insurance companies in the Southwest or the Southeast manage. And so, it really helps to ensure that experience. So they can be located in clusters. Pittsburgh is one of them, Orlando is one of them, Memphis, Tennessee is one. Oftentimes they are located to like travel hubs as well, just to make sure that for some of these more critical medications, they're able to get to the patients as soon as possible. And if you could throw it on a plane at Pittsburgh International and it's in the patient's hands by 8 a.m. the next morning, it makes a lot of sense to be able to do that. Now, the work from home piece is a very timely question. Most pharmacies do offer work from home opportunities. When I first started in specialties back at Credo a decade ago, I was a pharmacist that was working from home. They had a computer there. They gave me the phone. I was doing direct to patient calls every single day. Like I guess you could say I was doing this whole quarantining thing before it was cool back in the day. But the work from home opportunities are there. And so for pharmacies that may not have a geographic reach to where you are, if you're not located proximally to one of these pharmacy locations, the potential exists that you could work from home and you're a remote employee of a pharmacy that's somewhere else. Those tend to be the cases for the non-clinical sorts of things. So if you're a pharmacy technician or a pharmacist, you tend to need to be located closer to those locations for those other career opportunities, the business, the legal, the health systems, and the computer science. Those positions do tend to be more remote. You've actually been seeing over the last several weeks that there's been a need for more employees in those spaces. They are remote-only sorts of positions. You interview remotely, they ship you your equipment, you start remotely. That continues to be an area of hiring for these locations, particularly in the current climate that we're existing in.
All right, thanks, Jonathan. One of the chat questions came in from Lillian Longo, who's an alum and adjunct faculty member. She said she has done work for Highmark working with specialist home infusion versus ASC infusion. Could you maybe talk about cost difference or addressing the cost with related to that?
Sure. So yeah, no, that's a great question. And a lot of the therapies in the specialty space can be kind of gray in nature, particularly with some of these GI infusible therapies. It may be a consideration of where is the site of care for these patients. If you look to send it to a home infusion setting, generally you can contract reimbursement for those drugs at a different rate than you would if you needed to have that drug infused in an infusion suite. A lot of times it comes down to the type of care that you're providing. You're able to potentially have less expenditure if you send it to the home. The patient feels a little bit more comfortable because they're able to sit in their comfy chair at home and receive their infusion that they need there, as opposed to going into an inpatient setting that's a little bit more clinical in nature and a little bit has that sterile feeling. You're around other people. It tends to be a little bit of a difference in cost there. Sometimes based on the level of reimbursement as well, you're looking at different types of benefits. So you're looking at it from the perspective of a medically billed product where you can have a certain reimbursement rate, as opposed to a pharmacy billed product that's paired with nursing services that go along with it. Oftentimes, individual contracts can be designed based on how your employer is going to contract with your benefits to manage those things. And so generally speaking, you're seeing a shift for health management to move it more towards the home, to make sure that there's that improvement, there's that difference in reimbursement there. There's a better quality control if you're managing things through the pharmacy benefit as opposed to the medical benefit. I see your follow-up question coming in there about doing buy and bill and how those things could be addressed. So for those of you unaware, physicians historically have had the ability, if they own their own clinic, they can buy the drug from a wholesaler or direct from the manufacturer and administer that drug in their office. That, from a reimbursement perspective, was always great for physicians because it became a revenue stream for them where they could keep their clinics up and running, and the revenue they could drive off of administering these products could augment the office visit itself. Over the last several years, though, as insurance companies are trying to better manage and understand what their cost looks like, you lose visibility to what some of that drug expense is if it's being administered in a physician's office. And so oftentimes the physicians are able to be reimbursed at a little bit of a different rate too. So you're seeing that because there's a difference in reimbursement between outpatient and inpatient or buy and bill, that you're seeing more of a shift to try to move those drugs into the specialty management. On the specialty management side of things, specialty pharmacies have contracts with each insurance company to say, okay, well, if you don't do X, Y, and Z to manage these patients, then we're going to pull your contract. You're not going to be able to manage those patients any longer. Whereas on the physician side, in a buy and bill type of setting, you don't necessarily have those performance indicators to ensure the quality and the continuity of care. And so, there's more and more of a shift to move those types of products into the specialty setting as opposed to what has traditionally existed over the last couple of decades. Hopefully that answers your question, Lillian. If not, I'll make sure that we can follow up offline and talk a little bit more about that specifically too.
Okay, great. There's another question about how you find opportunities to work in specialty pharmacies, particularly outside of the pharmacist roles.
Sure. So, the first way to do it is kind of how I fell into specialty myself. I mean, it was 10 years ago, but it was just the job search through, at the time it was monster.com. I don't know if they're still around anymore, but, job boards like Indeed and all of those types of areas, if you search for specialty pharmacy or pharmacy and whatever your position is, those types of positions are being advertised out there on job boards. It just takes a little bit of finesse to look into those areas to find those sorts of avenues. If you search for pharmacy and accounting, it's going to point you into positions where you can find some of those opportunities within a specialty pharmacy to understand what they are. If you're not looking for them specifically and you're just looking at a job board for accounting, it's going to give you every CPA firm, every public, private, those sorts of opportunities. But if you start that search process by looking for those opportunities on just job boards in general, it really helps to draw some attention to those positions that might be posted. Oftentimes, I was on the hiring end at the pharmacy that I worked for previously, and we had a hard time trying to find those good candidates in all of those non-pharmacy, non-clinical areas because there was a lack of awareness for these positions that might be out there. And so looking through job boards and doing a search like that, or looking at the pharmacies directly to see specialty pharmacies near me on Google. Most of those pharmacies, if they don't publish to a job board, they'll have their own internal career site where you can look either through ADP or whatever it is to make those applications via that route. And so those opportunities are there. It just takes a little bit of thinking, hey, there might be an opportunity for me as a marketing professional for a pharmacy or a specialty pharmacy, and just tailoring your searches to look that way as opposed to just more broadly scattershot, I want to go find a job in marketing. So the positions are there. Oftentimes, like I said, in the non-clinical spaces, there's a need for these types of positions because it is a little bit harder to recruit when people don't know that those jobs exist.
Thanks. So I think maybe our last question to end with is a good one. They're asking for your predictions for the future of specialty pharmacy.
Sure. Oh, that's a kind of a loaded question,
I guess.
But I'll take it. So, specialty has continued to grow. I mean, you figured that it started 30 years ago, but the profession of pharmacy has been around for centuries, and so as more of these drugs are coming to the market, I truly think that you're going to see an expansion of opportunities. You're seeing more and more pharmacies that are coming out as specialty pharmacies that never did before. You're seeing community pharmacies that may have visibility to a patient population near them that can grow that expertise and become a specialty pharmacy once they get accredited and contracted and the like. And so you're seeing more and more of these pharmacies that are looking to specialize because that's where the future is headed. That's where you're seeing fewer and fewer new drugs that are being approved for things like high blood pressure. The drugs that are already out there work really, really well. Where you're seeing the new novel drug development is outside of that. And so within those scopes, you're going to continue to see that growing. Now, with that said, you've also seen a trend over the last couple of years where some of these smaller, more novel niche pharmacies build skill sets, they build expertise where they can handle these patients much more effectively. And they build this approach that you may not be able to see in some of the larger entities like a CVS, like an Express Scripts, one that might be more affiliated with a PBM. And so you're seeing that those companies come in and get gobbled up. They're purchased, they're acquired. They actually become a part of a larger organization to bring that more white glove expertise to the fold and actually help to expose and operationalize that. So you're seeing this concept of merger and acquisition happening very, very frequently. You're seeing partnerships between companies like Walgreens and Prime Therapeutics, where they built a new pharmacy called Alliance RX, and it's really not owned by anyone. It's not truly PBM affiliated. It's not truly retail based, but it's an alliance of the two, back ends that really help to bring things together to bring the best experience possible to patients. So you're going to see more from a merger and acquisition perspective. Last thing I think too is you're going to see more growth in the health system space. Years ago, it was more likely that a health system pharmacy would just partner up with an independent pharmacy to go out and manage their patients ongoing. And a lot of that was driven by insurance companies. Now that hospitals have the expertise, they know at the point of diagnosis where these patients exist, they're building specialty pharmacies internal to their own system, so that way it's a much cleaner handoff from the point of diagnosis to the point of treatment. And because there's more of a synergy there, you're seeing that organizations that never had a specialty pharmacy are just building their own, and they're growing from there. You're seeing organizations that are even proximal to Pittsburgh that are starting to build capabilities and capacity to have an integrated specialty pharmacy. So that way, not necessarily from a revenue perspective or losing patients, but more so from a patient management perspective. Let's find better ways to manage these patients on the whole, so that way there's a continuity of care. That patient's journey is a little bit more consistent from the time they receive that diagnosis all the way through their ongoing management. And so chances are you're going to see more and more growth in that space, where new pharmacies are opening up that are directly affiliated with those manufacturers, or with those health systems. I think the last piece too, where you're seeing more of this growth is in the curative treatment space. There's a concept of new therapies coming to the market in an area of cell and gene therapy, where manufacturers have found technologies where they can take some of your genetic data and they can marry it with their drug. And so that way it's more of a personalized, customized therapy for you. And those drugs, because they are customized for you, tend to be a little bit more curative in nature than taking a drug forever and ever and ever in more of a chronic type of way. And so you're seeing more of these drugs that are being developed from a cell and gene therapy perspective, that because they're curative, they also drive a higher price point. And so you're coming up on an election cycle. This is likely going to be a hallmark of anybody that's going to be running for some type of office, to say, well, let's talk about drug pricing. Let's talk about this and that, especially because there are these handful of specialty drugs that may tend to drive a higher price point. The conversation that tends to be left out is, yes, they drive a higher price point right here and right now, but if you look at the total cost of care for managing that disease over the patient's life, it probably still comes in a little bit cheaper than that one and done type of therapy. And so more of these therapies will be coming to market just because the technology is there from a drug development perspective to build more solutions than just these chronic take one pill by mouth once a day types of therapies. And so you'll likely start to see more and more of a growth from that perspective as well.
All right. Well, if there's no more questions in our chat, that's all of our pre-submitted questions. Thanks, Jonathan, for your great presentation. And thank you all for attending today's Alumni Insights. In a follow-up email, all the participants will receive a copy of the recording of this program for your reference and for sharing. If you or an alumnus that you know is interested in presenting an Alumni Insights program, a link to the application will also be in your follow-up email. So thanks everyone for taking part. Have a great day, stay well, and go Dukes.
Have a great afternoon, everyone.